Okay. Hi, Emma.
Hi, Jean. How's it going?
I'm good. Hello, everybody. And welcome, right, to UIHC Volunteer Services first virtual volunteer information session. I'm Jean Reed. I'm the director of the program, and it's my pleasure to be here today with Emma Carlson. Emma is our College Student Leader Board chairperson. We're super excited to have you all interested in joining our program this spring. You may already be familiar, our hospital has one of the largest student managed volunteer programs in the country. So in a typical year, we had nearly 1,300 volunteers contributing across the house throughout the year. And we always have information sessions to get folks started. Really reviewing information for the most part is what we're covering today. We share some information about UAHC and the volunteer program, discuss some of the more important topics. I think that everything's covered elsewhere, but we're really kind of hitting the high points, I guess, today in person. Usually it's a little bit more personal interaction, but hopefully you'll get a little bit of a sense of again, who I am, who Emma is, and we'll feel like you have a little bit of a connection to our program, as well as, again, all of the information that we've been sharing electronically thus far just to get you to this point. So you're close. We'll be seeing you on site soon. And I guess I'll just go ahead and turn it over to Emma. Emma is in the highest leadership position for a student program. Well earned on her part. She has, my script here says over 600 hours, but I'm pretty sure it's over 700 easily, probably more than that by now. And she served in the Stead Family Children's Hospital Prep and Recovery Unit, the Neonatal Intensive Care Unit, Developmental Care Volunteers, served last year on our Student Leader Board, and now has been serving in the highest leadership position in our program for the current year. And it's going to be her pleasure to review some of the basic information that you'll need to get started with the program. So Emma, take it away.
Thank you. So yes, my name is Emma, and I'm super excited to be able to talk with you a little bit today. There's a lot of information that we're going to be covering, but like Jean said, all of it is going to be located in other areas, other resources. The biggest one is going to be in your volunteer handbook. So almost everything we cover is going to be in there, but it's going to be, you know, a great resource to continue to look back at. By the end of this presentation, you're going to have to read through all of it anyway on your own, but these are just some of our highlights to make sure that you know and are comfortable and familiar with. So,
right, and a lot of them have already reviewed that handbook, right? So the gold standard. So you're on at different points in the process here. So some of you have already done the handbook, have already done the competency quiz. That's awesome.
Yeah, perfect. So to start us off, I'm going to talk a little bit about our program, like Jean said, talk about why our program, why our hospital is different than other places you might have volunteered at, and kind of what makes us special. So you're going to hear or probably have heard the term UI healthcare before. So this essentially is just an umbrella term that encapsulates the University of Iowa Hospitals and Clinics, which is the hospital that we are in, our volunteer services office is located in, the Carver College of Medicine, and then UI physicians. So if you hear this, don't be confused. It's just another term for our healthcare system. So a little bit of background on the University of Iowa Hospitals and Clinics. We are one of the largest university-owned teaching hospitals in the United States, providing tertiary or highly specialized care and referral services for physicians, dentists, and community hospitals all over the state of Iowa and the Midwest. So every day, our hospital serves over 800 inpatients and schedules another 3,000 plus outpatient clinic appointments. So this is really great. Our volunteer program gets to interact with a large volume of patients on a regular basis, which is, again, another one of those things that makes our program and our hospital very unique. In a typical year, like Jean said, we have over 1,300 volunteers as a part of our program to be able to supplement the staff in providing healthcare and making our patients and families' lives more pleasant and comfortable. So a little bit about our program. Our mission is to improve the experiences of patients and families at UI Hospitals and Clinics and UI Stead Family Children's Hospital. So basically, we are just wanting to make sure that we can provide, again, the finest care for our patients and families, and really be able to support them. So I'll give a few stats about our program and some of the ways that we are able to do that. So normally in a typical year, again, we'll use that a lot. We have over 800 college student volunteers, and a total of over 1,300 total volunteers. So all of those volunteers together normally will give over 100,000 hours to be donated back to our hospital, which ends up saving University of Iowa hospitals and clinics and UI Healthcare over $2 million annually.
Do you know who's in that picture?
I don't.
No, so that is one of my favorite pictures from our program. So that's Caitlin Sturm-Sallier, and she was a volunteer. She was on our student leaderboard for pediatrics and has become a child life specialist, and has been a child life specialist at our hospital and was a staff volunteer supervisor. So kind of that full circle with the leadership with the program. But I just love that picture, one of my faves.
Wonderful. See, and it does. I mean, it's kind of the gift that keeps on giving. And once you're in with our hospital system, it is a really special place because we like to keep you around for a while. So yes, a little bit more. We have over 100 different positions available within the program. And another really special thing is we have a lot of different areas where volunteer services, from Wild Rose Gifts or the Rooftop Cafe, different areas like that are able to actually generate revenue that we are able to turn around and give back and donate to our patients and families. So each year we do over 350,000, again, in a typical year, donated to funded programs that help to support our patients and family across all of our healthcare system, which is wonderful. So kind of moving on a little bit, talking about our student leaderboard. I'm really excited to talk about this, obviously, as the chairperson of the college student, of the leaderboard. I love to chat about it, but essentially this board is comprised of 18 people, including myself this year. They're competitively placed. They're highly experienced volunteers within our hospital and within our program. They help to coordinate the student volunteer experience. They help to serve as a liaison kind of between the staff on different units, as well as, me, as well as Jean and the staff in the volunteer services office, and you guys as volunteers. So they are really there to be a point of contact for you all and help to serve and coordinate along with the staff volunteer supervisors, multiple units, and a good majority of our volunteer placements. So another little bit more about them. Essentially, they are going to monthly board meetings. They are going to be having different meetings with me. They're going to be working with, like I said, with those staff volunteer supervisors, having meetings, working with you guys to come up with shift and schedule placements potentially, and different activities like that. So they are really integral to our program. We really could not do it without them. I am so, so grateful for our team. And it is definitely a wonderful leadership position, something that is, again, very unique and a kind of a one-of-a-kind place.
So actually, those are the folks that you're all going to be meeting in person with coming up, right, for your interviews and unit trainings. And this is our current board. The pictures, if you've spent any time on our website already, you probably run into some of those folks. But I always hold this up. This is absolutely a national best practice program, this leadership group. It's one of my favorite parts of my position here. I always say if everybody could just sit in my seat for one day and get to interact with the student leadership that are involved and engaged here at this hospital, you would not worry about the future at all. It's really, it's an honor. It's a privilege to get to work with this group. So I'm sure that you will enjoy the time and interactions that you get to experience as well.
Thanks, Jean. Next up a little bit, so another one of our leadership opportunities. We really like to talk about within the volunteer services program, we have a wonderful path to leadership. We have multiple different ways for you guys to get involved, not only just as volunteers within your units, but then growing within leadership and within our program. It's something that we are very proud of. So another one of those leadership opportunities is to serve as a unit mentor. So these are, again, exceptional volunteers that have, been able to serve and demonstrated exceptional and reliable service with our program and with their units. They are placed with the input of the staff volunteer supervisors as well as the student leader board members on units. Their duties can be all over the place. However, there are a couple of things that are pretty consistent with a lot of our mentors that they do on a regular basis. So they're going to work one-on-one with you guys to be able to train new volunteers onto the units. So a lot of you will be working with a unit mentor potentially as we're kind of getting into the swing of reorienting everybody and getting everybody onto our units. Many of you will potentially be working with these unit mentors. On top of that, they're able to orient volunteers to the hospital layout, get you guys familiar, with the hospital and with the different units we have, and demonstrating successful patient interaction and visiting skills. And this is a huge one. Patient interaction and visiting is one of the largest components of our program. It's one of the things that we, again, really pride ourselves on. It's what makes our hospital feel like a home, makes people feel like family. And so the unit mentors are definitely some of the volunteers that are able to demonstrate this exceptionally and will help you guys feel comfortable doing this, as it might be uncomfortable or unfamiliar at first. So that's a big piece of what they do as well. In addition, they also serve kind of as that liaison position between you and the student leader board members. So they, you'll be volunteering with them. They'll be on their units. If you have questions, they're another really great resource to be able to reach out to as well. And obviously, I'll talk about recruiting because many of you that are going to be watching our video will probably be, recruited as mentors or even as student leader board members. So all applications, anything like that, and information regarding recruiting is going to be up on our website. So definitely just keep this in mind. If you have questions, talk to your student leader board members about it. Reach out to me. I'd be happy to chat with you as well. But it definitely is an invaluable experience. So moving on to some of the fun stuff, getting into policy and things, what to do if you have questions. So this will be something that we will preach to you all the time. Read your emails, read your emails, read your emails. So they're going to come from the volunteer services office. If you have questions, check your communications that you've received already from the VSO. A lot of the times answers will be in there. However, if they're not, we do have a couple other ways to be able to answer your questions. Next, check your volunteer handbook. Like I said, all of the information we cover today is going to be in there, as well as the answers to a lot of the questions that we receive are normally going to be in that volunteer handbook. So make sure you check that out as well. Yes.
I'll just add, and if you have a question that you don't find in the handbook, let us know, right? So we're always updating that resource. And like Emma said, it's the gold standard. It's easily searchable. We encourage our staff volunteer supervisors, anybody working with volunteers across the house, that's your go-to for what the general policies are. But we need your help to make sure that it is giving you all the information that you need. So let us know if there's something that should be in there that isn't.
Absolutely. And we definitely call it a living document. So it's definitely something that we want to make sure that we are constantly updating. Obviously, guidelines are constantly changing. So it's definitely something that we like to keep a close eye on. So let us know. And then finally, obviously, if you have questions, reply to those VSO emails that you got. We say reply to the last email that you received from our office with any of your questions. It's the best way to get a quick response. All of our staff actually read all of your emails. So anything that you send is going to be read by an office staff member. I promise they will get back to you, even if it takes, a couple of days, but that is the best way to get a quick response.
That's another thing to think about too. So if it has been more than, we say 4 or 5 days, and you would expect to have moved forward or heard some communication, don't hesitate to respond to the last email. Send an email, follow up. But it's a two-way street. We've got a lot of people that we're working with. If you have questions, if you think you're wondering why maybe you haven't heard what you thought you expected, just send us an email.
All right. Again, more fun stuff. So now that we have a little bit of the information about the program, what to do if you have questions, we're going to move on to patient confidentiality and patient privacy. So protecting patient privacy can take a lot of different forms. Just the fact that somebody is a patient at the University of Iowa hospitals and clinics is confidential information, is something that needs to be protected through patient privacy. So just the fact that you saw somebody here, or once they walk through our doors, we have the responsibility, and these patients and families have trusted us to be able to keep their information private, and so that's something that we have to hold ourselves to that standard. In addition, there's also laws and regulations that also mean that we have to do that as well. So HIPAA is the Health Insurance Portability and Accountability Act. This is something that many of you are potentially familiar with or may have heard of before. So essentially, it's referred to as HIPAA, but it's a federal regulation to enhance the security and privacy of protected health information, also known as PHI. So it just gives patients rights regarding their health information, designates what penalties are in case somebody is to breach patient confidentiality. Essentially, this is really, really important because you guys can be held personally responsible for if you were to breach patient confidentiality. So it's a big thing. You guys are responsible for knowing it. That's why we talk about it in this presentation is, well, yes, it's located in your handbook. It's really important. So we're talking about it with you virtually to make sure that we cover it. So the other thing is reviewing the healthcare privacy notice brochure. So this is linked in your volunteer handbook. I encourage all of you, obviously you should have read through your volunteer handbook, but go through and do it again. Make sure that you check and follow that link to take a look at our healthcare privacy notice brochure. This is handed out to patients when they walk through our doors and basically tells them their rights and what that means, what HIPAA means, and what patient privacy is for them. So going into what is protected health information. So what is this information that is covered by HIPAA and what is this talking about? So the term PHI is frequently used within HIPAA, and so that does stand for protected health information. So our little graphic on the bottom, it's an identifier plus any health information is considered protected health information or PHI. So this could be any demographic information about a patient. This could be in any form as well. So any written information, anything that's spoken or anything that you're finding electronically can all be considered and fall under protected health information. This includes talking about it on the elevator. So you can't be talking about a patient's information or even a patient that you had on your unit with another volunteer as you're leaving your shift together. If you were to do that and there was somebody else in that elevator that's hearing it, that would be a breach of patient privacy, and that is protected health information there.
I think another way we talk about that also is on stage and off stage, right? So just being very cognizant of who else might be able to hear or see the information. Even if you do need to share it, right? To do your job, you want to be sure that you're sharing it only as appropriate.
Absolutely. And another one is I always kind of use this example because I think that sometimes the idea of patient privacy, you don't always think about it, what it would look like for you. You go, oh yes, I would never talk about a patient's information to some random stranger, or I would never, willingly give out information. However, it could be something as simple as your neighbor or even your family best friend you see in the hospital that day, or as you're going and making rounds, you see that they're on your list for flower deliveries that day. You can't go home and tell your family, your friends that you saw Susie around the hospital walking around when you were doing flowers. Did you know she was in there? We should send her a card, make sure that she's doing okay. Little things like that would be something that is still considered patient privacy and protected health information. That's something that you can't share. It could even be, sometimes it's hard. Sometimes people ask you, be like, oh, I heard that Bobby was in the hospital because he broke his foot. Did you see him? How's he doing? And that would be something that, you just can't share that information. You wouldn't be able to say, oh yes, I saw Bobby yesterday and, he seems to be getting around great. It's just little things that you don't always think about right off the top of your head. But any other examples to add, Jean, that are common?
I think those are good, Emma. Just being prepared for those questions. My mom always used to ask, oh, Bob's in the hospital, how's he doing? I would have to share, I don't know, Mom, but I'll go check. And actually it's, once you have heard about the hospitalization from another source, right? If the only way that you know the information is because of your volunteer role, then it's PHI. But if you hear about it from another source, right? So my mom calls me and tells me about Bob being here, then I'll go visit, right? And I'll say, hey, Bob, I'm Jean, my mom. I want them to be sure that they understand, right? That I didn't access this information inappropriately. I'm going to say, oh, I heard from my mom that you were in the hospital. I thought I'd stop in and see if there was anything I could do for you to help things to go better. And I think, you don't have to navigate all this on your own, right? You're going to be serving in areas where we're all aware and been working with this for some time, and especially in our pediatric areas, right? So those policies are even more strict, and there are lots of resources. So anytime you have questions, right, reach out to your staff supervisor, your board member, the volunteer services office. We're all here for you.
Awesome. So moving on a little bit, these are going to be some examples of protected health information. So a lot of these, I think the first time that I saw them when I was reading through the volunteer handbook, I didn't even know that all of these existed as, as PHI. So it's definitely a good thing to be able to read through, really think about it. Again, it's that identifier plus healthcare information falls under this PHI category. So a photograph or a name, an admission date, diagnosis, any of these can be considered PHI and material that you need to keep private. So the other
telephone, right? That's a perfect example because it could be personally identifiable. You could be exposing the identity of an individual through a phone number. And you need to protect that in the same manner that you would your social security number.
Yeah. Yeah, that's a great, we always use it as an example is like, okay, if you saw your social security card sitting out on the counter face up with all of your numbers facing up, would you want it to remain that way? Or would you, the first thing that you do is flip over that piece of paper and make sure that no one would see your social security number? You're going to flip over the paper and make sure no one sees it, right? Because somebody could steal your identity. Same way with this. So we need to take that same consideration when we're looking at a patient's PHI and treat it like it's their social security number. Treat it like it is that important that you need to make sure that no one additional is seeing it, no one outside the scope of, what they need to do to complete their duties, that if it's outside of that scope, then it should be protected. It should be hidden. It shouldn't be discussed. It doesn't need to be discussed because it is that patient's privacy. And we'll kind of get into this a little bit. So that's kind of talking about like accessing it on a need to know basis only. So don't go searching for information that is something that you don't need to have access to. You don't need to know. You don't need to go searching for a friend's name or something through a roster that you have access to, or, oh, you see, there was an accident and you saw a name that you recognize, and then you go searching through the roster to see if anybody else is in there. It's really easy to, some of those situations, it's really easy to want to go do that. However, that would not be on a need to know basis. It might not be something that you need to be checking on. And in that case, just stay away from it. Again, kind of going off of don't share that PHI unless it's job related. So you don't need to necessarily tell demographic information about a patient maybe that you learned to a nurse. However, if she's asking about the name of the patient that you just talked to, that's something that you can give them, or a room number or things like that that are necessary to be able to do a job. That's something that you can share. Just don't share unnecessary information. Yeah, the next piece is going to be disposing of it properly. So again, we kind of talk about flipping it over if you see it, if you're walking up to the nurse's station and all of a sudden you see maybe a patient chart, just being considerate and flipping it over. However, if you are going to dispose of something, you notice that something's sitting out, or you see a patient's wristband, a hospital wristband sitting next to the trash can or sitting next to on a counter or something, there is a special place to be able to dispose of PHI, and it's not in a trash can. So we can't throw PHI information just away in a normal trash can. That's something that we don't want to do. There are special shred bins or shred all bins that are gray that you'll see, and they're locked and they have a little slot at the top for you to be able to stick information and paperwork into, and all of that information goes and gets shredded so that you're not able to pull a document out of the trash and again be able to see that PHI. So, and then again, report a breach of confidentiality to a privacy officer. There are steps for this again, and there's more information in your volunteer handbook. If you have questions, consult there, reach out to your student leader board members, and reach out to us in the volunteer services office if you have questions. So I know we kind of talked a lot about PHI a little bit, but a few reminders can go a long way. So it's good to make sure that we talk about it. But kind of next on this is PHI, like I said before, it doesn't have to be written material. It can be a photograph. It can be information that you're sending via text. It can be a post on social media, which is kind of going into then our technology guidelines. So we don't use personal cell phones or personal technology while we are volunteering or while you are on duty. So the best thing that I say, this says regulate cell phones. I say turn them off. I say that's the easiest thing to do is turn it off and leave it in your bag. There's places to be able to store your things on your units. So just make sure that you turn off that cell phone, put it in your bag, and put it away. Is my recommendation. Otherwise, just turn it off. and make sure that it's off. You just don't want to be using personal technology for the same reason that you wouldn't want your doctor coming in and being on his phone when he's getting ready to go into a meeting or going into a doctor's appointment with you. You don't want to be on your phone or being seen on your phone when a patient is walking around or maybe needs help and you miss that patient or they feel like you are unapproachable, right? I don't like to walk up to people that are sitting down with their head in their phone because I feel like I'm bothering them. So the same thing goes with this. We want to be that open resource for patients or visitors in the hospital to be able to come to. Going along with that, don't take photos of patients. Don't use your cameras. Don't post patient-specific information. Again, it's considered PHI. And connecting with patients on social media crosses professional boundaries. So don't do it if you see somebody in there and then you try to go follow them later. That's kind of a breach of privacy as well. So. And this is, I struggle saying this, so if I trip up, don't laugh at me remotely. But this is a really good way to remember information about protected health information and what to do about patient privacy. So we say what you see here, what you hear here must remain here when you leave here. There's lots of here's. Thank you, G. So yes, just remember this mantra as you're going through. Again, we said if you have any questions, reach out. So next, we're going to get into some more really fun information. So safety information on when you get, I don't have mine with me, but when you have your badge, Jean will be, there we go. When you have your badge here, and you'll be able to go pick that up eventually. On the back of it has emergency numbers and codes to be able to call. So we have house phones that are located all over the hospital. We have some in our office, any like landline, telephone, anything like that. You're able to call any of those extensions that are found on the back of your badge, as well as there are more inside your volunteer handbook that you should read over. But you're able to pick up one of those house phones and be able to call those extensions for all of these different codes. So we say code blue is a medical emergency. Our code green is going to be a combative patient. And then 195 is that fire and safety emergencies. And all of those are located on the back of that badge. Never dial 911. We have that in red because it's important. First instinct, right? Since you were little, this is like the only place you're ever going to hear don't call 911. Ever since you're little, the first thing you're like, oh, emergency, call 911. Because you're in a hospital, you don't have to do that. There are faster extensions that are going to be safer and easier to use. For example, that 199 or 192, 195 number, call those. We're going to be able to respond to it a lot faster and safer than it is to call 911 when you're located inside a hospital. Next piece is those safety reference cards as well. So these are going to be just for emergency information. They're referenced in your volunteer handbook as well. But these safety reference cards can be found when you get to your units. We have binders that have a lot of information for your unit and for volunteering within them. And these safety reference cards are going to be located inside of there. So you can always ask your SLB where those are at or for more information if you are curious. Next, we're going to talk about one of our favorite topics as of late. We're going to talk about some safety precautions and standard precautions. So for health and safety guidelines. So essentially standard precautions are set by the CDC, the Centers for Disease Control and Prevention. And it's basically just there to minimize the risk of transmitting infection in healthcare settings. So, eliminating the risk both for the safety of our patients and for the safety of our staff and the safety of you. So, we don't want you guys getting sick. We don't want our patients getting sick from anything that you're bringing in. So we are really, really, really dedicated to making sure that we follow these standard precautions. This is a huge thing. So kind of a general guideline that we have is that if it's wet and it's humid, don't touch it. Just don't touch it in general, stay away from it. There are sets of guidelines for how to handle these that staff will know, or potentially you would be trained on further depending on your unit. So if it's wet and humid, just stay away from it unless you're properly trained. And then the single most important thing we can do to prevent and reduce infection is to perform hand hygiene, right? We're hearing this all the time, obviously with the pandemic. This is some really important information. I'm sure you guys are all familiar with some of it, but it's definitely good to review. So I'll kind of go to our next slide, but these are the times that you perform hand hygiene. So we say anytime you cross a threshold, we say, use the phrase that's in our bottom right corner, foam in and foam out. That's just how you remember to do it. So when you walk in somewhere, you're putting on hand sanitizer, performing hand hygiene when you walk in and when you leave and cross a threshold. So you're going into a patient room for the first time. When you go in, you're using hand hygiene. when you come out, you're doing hand hygiene, you're using hand sanitizer. Doesn't matter if you're going in there just to chat with them and saying, hello, I'm a volunteer, and then turning around and leaving, you're performing hand hygiene on the way in and the way out. It's just good to be able to get into the practice of it. So that way it becomes like second nature. So you're not even thinking about it as you're walking around. That goes for different rooms, units, doors, all of that good stuff. It's just best practice to use it. When in doubt, I always say perform hand hygiene anyway. But, before and after direct contact with the patient, before you're putting on PPE, which you will only do if you are trained how to do it. So that would include gloves. After contact with any patient's intact or non-intact skin, bodily fluids, anything like that, and inanimate objects in a patient vicinity. So anything that a patient could have touched, if you're moving their water bottle closer to them, you're going to perform hand hygiene after you're touching it as well. Just good to be able to keep some safety. But there's more examples in your volunteer handbook as well. And then the rule of thumb, we say, as you're performing hand hygiene, in addition, this goes for washing your hands, right? So the best way to stop and prevent infection, the rule of thumb, the golden standard, wash your hands, right? So using soap, warm water and soap is going to be a wonderful way to perform hand hygiene, in addition to then using the hand sanitizer as you're walking around a unit. Jean, would you like to demonstrate how one should wash their hands?
Gosh, I'd be happy to, Emma. So I do think this is something that if you haven't been in a healthcare environment before, this is all about habits, right? So getting into good habits as you start your on-site service here, that foam in, foam out is non-negotiable, right? So we have secret shoppers that are out there to help us get our hand hygiene percentages as close to our goal is 100%, right? And the only way we can really get to 100% is if it's a habit. If you don't have to think about it, right? We're humans, and when we have to remember something, we're not going to be able to get to 100%. So that foam in, foam out that Emma was talking about, right? That crossing the threshold, we're talking about in our inpatient units. Anytime that you go into the patient care environment, and after you do this for a while, hopefully you won't even have to remember to do it, because you're just going to do it walking in and walking out, and that's how we get to 100%. So the demo that I do is for actually hand washing, but hand hygiene includes both soap and water, which we would usually recommend. Wash your hands with soap and water when you get to the hospital. Wash your hands with soap and water before you leave the hospital. You're going to wash your hands with soap and water after you use the restroom every time. It's best to use soap and water before you are going to take a break and ingest, right? If you've taken something to your mouth. But really, for most interactions, that waterless antiseptic that is going to be mounted on every patient door so that you can do the foam in, foam out consistently is probably going to be your best bet. And the hand motions are the same, but the length of time is different, right? So Emma, how long do you think you should wash your hands with soap and water to do that appropriately?
Jean, my guess would be between 15 and 30 seconds. Is that about
super, super good?
not
so
the
like scrubbing you into surgery hand hygiene, but I guarantee it's longer than you're probably doing it unless you're already in healthcare, right? So that's really the length of time that Epi is saying you need to be making friction with warm water and soap. Are you going to do the timing, Emma, for me? Would you?
Oh, you want me to sing for you? I can speak.
I'll do the demo. You just do the time so that we can keep. So going to get your hands wet, right? And use a pump of the foaming soap. And then you're going to get all of the contact surfaces, right? So your nails underneath, your nail beds, your thumbs, right? Your wrists, in between your fingers, the backs of your hands. So there's a lot of surfaces there that you want to get friction going on. How close am I? Should be pretty close, Emma.
Next time, won't you sing with me?
Yeah. So I think the key is it's longer than you think, and there are lots of surfaces that you want to be sure that you're doing well. So 50, like Emma said, 15 to 30 seconds. Practice. She was giving you a little bit of a hint as far as some of the things that we do here at the hospital. so that we don't get sloppy and do that shorter time than we should. And Emma, what was your?
I was singing the ABCs, and you start with A and you end all the way at next time, won't you sing with me? And about that length is going to be about that 15 to 30 seconds when you sing it. So in that video, you'll see me mouthing my ABCs so I can remember as Jean was going, and I can actually time it, or it's the happy birthday song twice. So those are both two kind of good reminders. If you've got another one, wonderful.
I've heard Twinkle, Twinkle, Little Star, right? Or, counting it out, 1 Mississippi, 2 Mississippi. But I think the key here is, again, we're humans. Habits are key to helping us get to 100%. And those are just some ways to help you remember how long you really need to wash your hands with soap and water to do it right. But again, the same hand motions, right? I'm doing the pump in the room. Get a pump of that. Waterless hand antiseptic Avant is typically what we have here. And those, which is very similar to what you buy in the grocery store, right? The hand sani. And it's the same motions, right? You need to still get all of those surfaces damp with that sani. And then as soon as you're dry, you're good to go. So it's much quicker. Also doesn't dry your hands out as much. It's much more convenient. To do. So that's probably what you're going to be doing most of the time is the hand sani. But it is a practice, right? So when you get to a room the first time, maybe you're holding something, you're on, it's a groove, right? But it's one of the most important things that you can do.
Yeah.
And do we have that statistic slide, Emma?
I don't think we do.
I think we took it out, but I really like it. So they estimate that in any given year, 100,000 patients die from hospital-acquired infections. And if you would guess how many of those deaths could be prevented if we all just followed those guidelines for hand hygiene, and it's over 95%, maybe 98, 99%. Which is a pretty phenomenal statistic, right? Because it seems like a simple thing, but hand hygiene, and that's not just doctors and nurses, right? That's every housekeeper that comes into the patient room to change the trash, or food nutrition bringing a meal, or a volunteer delivering the mail, or a well-intentioned patient family member, right? Or visitor that comes into that environment. And many of our volunteers help our families and visitors to be able to follow those guidelines.
Yeah, it's wonderful. If they're able to see you doing it, they're more likely to do the same thing too. And if you're volunteering with, another volunteer or even other staff members, remind each other. It's a great way to be able to talk it through, especially as you're starting out, or even in your orientations and things like that onto your individual units as you're going through. Remind each other and talk about it, because like you said, the more times you do it, the more times you think about it, the more it becomes habit and the more likely it is to be so. So yes. All right. Kind of moving on from that too. So our isolation and infection control signs are going to be used in a lot of units at UIHC. These are these 6 little squares that you're seeing are all of our different infection control sign options that we have posted throughout the hospital. You're going to see them. They have lots of different colors, obviously, like you can see, but each of these signs basically indicate the precautions that need to be taken before entering that patient's room or that area. For volunteers, the only area or the only sign you can see, the only one that has a green check mark on it, is the only one that volunteers are allowed to go in with training. And that's going to be with contact precautions. So if your unit would have anything in their unit that's going to have contact precautions and feels like you need to be trained, they will go through the proper steps and you'll receive that training in your unit. Some of you might not be trained in this and some of you might. However, this is important because it's the only area that you can go in. If it's a droplet precaution or an isolation precaution, or excuse me, a droplet or airborne precaution, you are not allowed to go into that room. Only contact precautions and only with the proper training on how to put on and take off PPE. This includes gloves. So if you are going to put on or take off gloves, you need to be trained in the proper way to do so. Again, they should be able to show you this within your orientation or specific trainings.
Yeah, so I think about our information session in our handbook, right? This is all the material that's needed to just so that any volunteer can come back and be safe in our homes, right? But obviously the volunteers who are going to be assigned to the gift shop need different training than the volunteers assigned to our bone marrow transplant unit, right? So they're going to have cash handling and different things. We don't cover any of that here. And on our bone marrow unit, there's a lot of isolation guidelines that need to be covered. So I do think what our takeaway with this slide really is, and we have a lot of isolation rooms here. So you need to feel confident. If someone directs you to go and do something in a room and there's an ISO sign, you need to feel confident to say, no, I'm sorry, as a volunteer, I'm not able to enter those rooms. And again, for contact precautions only, if you've been trained and are directed to go in, that again, you need to be competent in your training and being able to advocate for what you need to be safe.
It's another one of those things, kind of like HIPAA, where it is your guys' responsibility to be watching for these signs and to be reliable and dependable on making sure that you are stopping before maybe you enter a patient's room and looking around, being aware of your surroundings before you're entering, just any room. So hand hygiene and check for those isolation signs before you're going into those places, to keep an eye on it. It might be uncomfortable having to tell a staff member no. However, not everybody is necessarily aware of a volunteer's guidelines. That's where it's your job to make sure that you are letting them know what you can and cannot do. So kind of going off of that, we're about the can and cannot do. So these are some of the things that are off limits for our volunteers. They're located again in the volunteer handbook, but don't give patients medication under any circumstances. Don't give fluids or food, even if it's water, to a patient without checking with the nurses. Many of our patients might be on a specific diet restriction, or are not allowed to be, taking anything by mouth if they're prepping for a surgery or anything like that. So you need to check with the staff before you're just bringing something to a patient. You're more than welcome to bring food and fluids as long as you receive the proper approval to do so. Another thing is pushing a patient in a cart, turning a patient in bed, or removing patients from the bed unless you've been trained, one, and are assisting a staff member, two, in those tasks. So you are allowed to do it, but you have to have the proper training and you have to have a staff member with you. So just make sure that you're keeping that in mind. Again, no taking a patient off a nursing unit without permission from the nursing station. We do patient transport a lot in a lot of our units, a lot of our patient-facing units. It's okay to transport patients. However, you do just need to make sure that the nurses are giving you approval and are aware, so they don't think you're running off with one of our patients or their family members. We just like to make sure we know where everybody's at before they're just wandering around.
I think the confusion with that really is a volunteer is directed from one area to go and get a patient. And you still, before you do that, you need to notify the staff, the care staff on the unit that maybe wasn't the one that directed you in the activity, so that we're all on the same page.
Communication is kind of key here. It's the name of the game. So best thing to do when in doubt is just to make sure that you're having that open communication with anybody. So
I have a really good story on this one, because I had a staff call who was like, this volunteers can't follow directions, not following directions, and I need your help. And they said that I've said several times they should not take the patient off the floor. And they have taken the patient off the floor twice after I instructed them. And I'm like, this just doesn't seem possible, knowing this individual. But when they came back, I talked to them and I said, so what happened on the unit? Well, I don't know. The nurse was really, but she told me not to take the patient off the floor. I never left the third floor of the hospital. Every time I came back, she told me I was doing it wrong. So that's one of these things where, yeah, in our hospital, sometimes our terminology isn't as clear and transparent. So when we say off the floor, we don't mean the entire third floor of the entire facility. We mean the unit, 3, whatever. There are several different patient care areas. And I just think that's a good example of, when you talk about communication, both of those people knew that something wasn't clicking. And I think if they had done a little bit more proactive discussion at the time, how quickly that could have been addressed.
Yeah, definitely could have been addressed. A funny, unfortunate occurrence, but
but a good example, right?
Yes, absolutely. So another one is don't go to the hospital if you have a cold, rash, infection. Again, you guys probably are familiar with this with COVID and all the good things that are happening um, now. So just keep that in mind. Don't come if you got a cold, rash, infection. Um,
So again, your handbook has got more up-to-date information, right? Because we've got all of the COVID symptoms and it's 24 hours fever-free without fever reducer. I mean, there's more specific things there. And your handbook will have the most up-to-date information.
yes, definitely be checking there. Again, that's why we say it's a living document. It's definitely something to be checking up on regularly and constantly gets updated and changed. And this one I find funny, but it also does happen. Don't purchase cigarettes for patients because the UI Health Sciences campus or UI Healthcare, is a smoke-free institution, but you will have patients that will potentially try to ask you to go buy cigarettes for them. Just remind them of this and tell them, no, unfortunately, I can't do that. But every now and then you might get asked this. So keep it in mind. That's a no for us. Okay, and then going into professional standards. So the biggest thing is photo ID badges by anybody, staff, volunteers, our janitorial staff, anybody has to wear a photo ID badge visibly above the waist when you're on duty. Jean showed you her badge. That's what it's going to look like. And volunteers have this lovely volunteer hang, which obviously Jean is not volunteering right now in her role, but it sits down and it's got a black bar on it and it says volunteer in big white letters. Um, she might have one with us, but that's what you're going to be able to have on. You'll be wearing that with your badge. I always recommend just pinning it up here to your collar. Normally uniforms will be, there we go. There's our hang tags. Jean is also volunteers with our program in a typical year as well. So she's got those around plenty. There you go. She is a pet partner. So she's got two little Pomeranians that I absolutely adore, and one of which is good enough to be able to come in and do to do some patient interaction with our pet program. So, but yes, so normal uniform is traditionally and typically a white volunteer polo. For our college student volunteers is a white volunteer polo and khakis. Is what we do normally with closed-toed shoes, or wear closed-toed shoes when you're in the hospital as well. So that's going to be normally what it is. But then for the volunteer badge, I recommend the polo is going to have like a little collar on it. Just I'd clip it up there. It just makes it easier, keeps it above the waist, and is clearly visible. Essentially, you want to make sure that when you are talking to a patient, or maybe you are, reaching for something, that they're able to clearly see you and your name, but also be able to see that volunteer hang tag that says volunteer on it, right? We want them to be able to recognize and notice that you're a volunteer, because sometimes you will get asked things that normally they might not be comfortable asking a staff member or things like that, because they do see that you're a volunteer. So a little bit of information for the polos. So Volunteer Services has specific polos for you to be able to wear if that's what you're required to wear, based on, you'll know from your student leader board member or your community lead, depending on where you are going to be placed, as far as what your uniform looks like. But the polos are $28. They're for sale in the Wild Rose Gifts, which is on the first floor near the main entrance of the hospital. Again, I know that obviously you'll have to pay for this, but all of the proceeds that you're paying for will go straight back into that funding that we talked about. So all proceeds from Wild Rose Gifts go straight into those programs that we can give back to patients and families, and we keep them literally at cost what it is to be able to make them. So, Jean.
Yeah, I was just going to say, we actually don't make proceeds on the shirts. The other gifts in the gift shop, we are, yes, hopefully making a competitive margin to return to patient family programs, but the shirts are available at cost to you guys.
Awesome. And then basically just professional appearance is a must. So there's more professional appearance policy and guidelines in your volunteer handbook, as far as things referring to shoes, referring to what to wear, as far as jackets or things like that, covering while you're on a unit, in a unit, walking around, that's covering that logo. So if you wanted to wear sleeves or a jacket or something underneath your polo, that's wonderful. We've had volunteers that sometimes will wear cardigans, just as long as that volunteer logo is visible on your polo, and different things like that. If you're a community volunteer and your professional standards or your policy for dress is different than the polo and khakis. You'll be able to find that information in the volunteer handbook as well for more details. Alrighty, and I am going to pass it over to Jean now that I've given the really fun information of policies and what to and not to do.
So I think really, I'm just going to have a brief section here today that focuses a little bit on preparing you to come back and be successful, right? Which I think probably all of you are hoping to have good patient interactions, to improve the patient and family experience. And many of you may have already spent time in other healthcare environments, but maybe not a lot of you have spent time in as large of an institution as ours. And it does feel different now in service. And I think you have a great opportunity to practice some skills, or at least be ready before you come back for your first shifts to initiate in interactions in a comfortable way, right? So when we talk about what our successful mentors and board members are, it is a lot about practicing how to build rapport, how to start a conversation, how to make people feel comfortable and cared for, right? Which sounds like it should be pretty straightforward, but I think there are some tips and tricks that our experienced volunteers can offer that you might find helpful. So as far as how to have a successful engagement, wayfinding, I feel like this is such a big place, and you guys are going to come here, and I get you're not going to know your way around either, right? For a while, it takes some practice. But if you have the opportunity to walk with folks to appointments or escort folks, I think it can be one of the most rewarding experiences that you'll encounter here, which is saying a lot, honestly. But we talk sometimes about, warm welcomes and fond farewells. And I think it has to do also with those are especially vulnerable times for our patients and families. And so sometimes the smallest gestures can have the biggest impact during those times. And if you have the opportunity to be the first person to speak to a patient or family when they get to our facility, you have the chance to change how they feel about everything that happens here. It is a big place and it can be intimidating, but that personal connection, bringing it down to that one-on-one is the quickest, surefire way to bring it back down to, again, a comfortable, caring environment. We have the resource Dialing 101 from a house or help phone, I think is a very underutilized resource. But 101 is basically you're getting connected to the operator, right? And when you get to our facility, you'll see on the first and second floor, there are quite a few signs by phones that have a big help sign, and they're blue, and they are there to help direct our patients and families to feel comfortable to pick up the phone that's there and call 101 if one of us aren't there to help them find their way, right? But the best kept secret is anybody can use those phones. And even better, every house phone is a help phone. So I can pick up the phone on my desk right now. I can call 101, and I'm going to get the same awesome people who have the entire patient census available to them, right? So all of our inpatient locations, all of our ambulatory visits. If you are calling from a blue house phone, they can actually see where you're calling from to help give directions. So my challenge is dial 101 within the first week that you're here. I talk about habits. That's a great habit to get into. And if you don't use it at the start, it seems like people tend not to rely on it going forward. So I think if you use it, you'll get hooked on it. I mean, I've been here a long time. I'm probably not going to direct a patient or family member. Even if they say, oh, I'm here, I just saw Uncle Joe yesterday, I'm going back 6JC or whatever, I could direct him to 6JC. But you know what, if Uncle got moved last night and is on a different unit, all I need to do is pick up that phone and just confirm that is exactly where they need to be going. So have some confidence, even if you don't know your way around that well. Two people are better than one, and walking with folks is a great way to build rapport. The information desk, I would encourage you to go check out. There's a ton of awesome resources there. You're probably not going to actually go to those locations because they're not, I mean, unless you're right at the entrance, it's not probably going to be convenient, but do stop there within your first few shifts and take a look at, there's a lot of good resources there, and the staff are happy to kind of help you through the most frequently used resources there. And depending on your area of service, there'll be some questions that are very common. I mean, parking, the wayfinding pieces are just are very common. We have some tips and tools in the handbook too, but I think, Emma, can you pop to the next slide? Yeah, so help break the ice. I mean, that's really what success is all about. And my encouragement would be to be your most outgoing, authentic self when you're here. Be the one to start the conversation, right? Even if you're not usually, make up your mind that when you're here, you're going to make eye contact. Elevators are a great place to practice this, right? Make eye contact, smile, say, we call them smiles now, right? Can't maybe always see that smile, but you can still see it in the eyes. Introduce yourself. Hi, I'm Jean, I'm a volunteer. Be the one that initiates the interaction, even if that isn't who you usually are in the community. And honestly, some of you maybe are, right? Maybe some of you are like, I can chat anybody up in the grocery store line, and that is awesome. And a skill that you'll put to good use here. But you could still maybe want to think about the things you say in line at the grocery store might not be your go-tos here, right? So have a nice day, probably not going to use that one here. You just need to be thinking, you're probably not going to know what's going on the other side of those interactions. So you want to be sure that you're using openers and closers that are appropriate and comfortable. And you'll have more confidence in starting those conversations. The three questions that I have listed here, they're nothing special other than they're my faves. So we're not trying to script your interactions, and you maybe already have some things that you like to open conversations, and that's awesome. The three things that are listed here I like because they help me to know a little bit more where people are coming from. So when I'm on an elevator, a lot of times, I'll say, hey, I'm Jean, I'm a volunteer. How are things going for you today? Have you been here before? Is this your first visit? Because their response is going to tell me a lot, right? If it is their first visit, I'm probably going to walk with them no matter what. The first visit can be really intimidating, and just having somebody go with you can make a difference. Also, if they tell me, no, I've been here for 2 months, or that I'm here from Iowa City, whatever it is, that tells me something too. If they've been here a long time, then maybe my challenge is going to be to think of an amenity that they might not be aware of that I could share with them that they would enjoy. And again, I've got kind of a list of things. Hopefully you'll have spent some time going around to the different cafeterias yourself and picking out maybe some favorite things that you think are worth recommending. I always mention there's a for real machine in some of our cafeterias. And if there's kids in a family, I always say, check those out because they're kind of fun, way to make a milkshake. Figure it out when you get here, give it a try. But like on the air care, right? I always say, hey, have you seen the helicopters? There's a place where you can go and actually see them take off and land. Just different things like that. And again, get familiar with some of those amenities so that you are ready to recommend them when the opportunity arises. Are you from around here is another one I really like because it's one of the easiest conversation starters anywhere, right? But it also tells you something. So if they're from Iowa City, maybe not that big of a deal if they're here and you can chat about what their favorite restaurant is. But you know what, if they're from some little town on the other side of Iowa that I've never heard of, again, it may be a very different experience from here. And I'm going to want to maybe provide a little bit more companionship and support if that's their answer. But also you can probably pretty quickly come around to something in common in that kind of a question. And that helps people to feel comfortable. And then the other thing is, how are you going to close that conversation? Sometimes that can be the most awkward, I guess, part. You're not going to say, like I say, have a nice day is probably not how you're going to get off the elevator, or leave that patient room. And I hope things go well for you is one that I use a lot. Up here on the 8th floor, we have a lot of families who are here with a loved one having surgery, and so they're on the elevator coming up from to the surgical lounge, and that's a really tough day, right? That day of waiting. So just I hope things go well today. Take care. Take care is another good solid closer that I use a lot. But again, it's not so much the scripting as much as that you're ready. You know what you want to say, so that you have confidence in starting the conversations and closing them when you get here. You'll be surprised at how much impact that can have in a place like this, to start those conversations.
Absolutely. It might be awkward at first, but I promise the most rewarding conversations, the most rewarding time that I have spent volunteering has been starting a conversation with somebody randomly, or you end up finding out that they're lost, or maybe that they do need help. And all of a sudden you just change their entire experience of our hospital and their view of what they're going through, trying to navigate somewhere, trying to, locate something. All of a sudden you are there and you are that resource for them. But again, it might feel awkward for you. I promise it's not going to feel awkward for them. They're really going to appreciate the extra interaction, the extra consideration, the extra thought to try to start a conversation with somebody.
And that's really what it's about, practice, right? Get in there and practice, and that will lead you to success.
It's why the elevator is great too. The number of times that I've flubbed up on my words, and then all of a sudden that's the next floor and they're gone and they're not going to remember me. But I will know.
They might.
But I will be better prepared for the next patient or visitor that comes along. I will know that I'm not going to do that again. So.
I think, so the next slide, we use the Iowa greeting here, and that's especially in inpatient rooms. So as you are going out on inpatient units and again, entering the care environment, you're always going to knock, right? Respectful knock. You're going to use that hand sanitizer I always say, so clinically, if you stand outside the room and use the hand sanitizer and then walk in, it's the same good clinical practice. But if you use the hand sanitizer and you're doing the motions as you walk into the room so the patient can see you, that's just another way to demonstrate to them visually that we're safe, that the care that you're providing, that the volunteer is practicing those good safety policies and practices, just like all of our other care teams. So perception is a lot. Again, especially when people are vulnerable. So the Iowa greeting is again kind of a guideline for opening and closing interactions in inpatient environments. So, hi, my name's Jean. I'm a volunteer. I'm here to help with whatever, read your mail, deliver your flowers, whatever it might be. And I think, like Emma said, your volunteer hang tag, I'm a volunteer, in addition to just being good practice, will help you to build rapport. Patients have a different perspective. They have so much respect for our care staff and how busy they are, and they don't want to bother them. Nobody wants to be a bother. Who wants to be a bother? And they'll have maybe greater comfort in asking for things or help from you. And then the closers here also, I think, can help encourage that. So is there anything else I can do for you before I leave? I have the time. I encourage our volunteers to add, I have the time, right? I know that our care, if they knew, they wanted a blanket, they wanted, whatever it might be, I knew they would do it for them, right? But the patient doesn't always want to ask. So how can you make it easier for them? Is there anything else I can do for you? I've got the time. And then the thank you, I think, is sometimes maybe the hardest part for volunteers. That it maybe doesn't seem sincere, that, well, maybe the doctors and nurses say, thanks for choosing UI Healthcare or something like that. But I can tell you, as I said, I also am a volunteer in addition to my paid professional position. And when I'm done with the visit with, my little dog, it was their choice, right? To let us come into their room. And it is tremendously rewarding to me to have that opportunity. And so it is perfect. I always say, thank you for letting us visit with you today. And that is true to the bottom of my heart. It's a privilege. So I always say, thanks for letting us visit. Take care. And oftentimes that also allows them the opportunity to show appreciation and recognition. It's just a nice way to close an interaction. So I don't want you to say things that don't feel comfortable, but it certainly is a sincere and authentic closer for me. So I don't know, do we have another slide? Yeah. So what are you comfortable? Sometimes people can be intimidated by, what can you do safely to help a patient? If they light their call light up, don't they need a nurse? Actually, no. Most of the time they do not. Sometimes they do. And if that's the case, you can still be helpful by saying, oh, how can I help you today? And if you need a nurse, I'll go and help too, because maybe that nurse is busy with another patient, and just having you help to communicate that as soon as she's done with, the patient that she's assisting now, she'll be in to help you, can make a difference, right? But we have some lists of things, and that's also in the handbook too. The most common things are, if you can't do for yourself, right? You can't reach something. What a frustration that is, right? So oftentimes it's my cell phone's I can't reach my cell phone. I can't reach the call light. The call light's fallen. Simple things, environmental things. And you can be a superhero if you can come in a room and address, some of those kinds of environmental concern. Answering their phone, helping them reach their phone, adjusting the lights, adjusting those types of things in the rooms, the blinds and the windows. Those are awesome things for volunteers to help with. And think how much time that saves. If the nurse doesn't have to respond to a call, if our volunteers have been proactive. On some units, you may be assisting with rounding, right? Because we know that if we're proactive and we go and ask in those rooms, we can cut down on those urgent calls. And that helps things to go more smoothly too. So look at your handbook, and again, get comfortable with the kinds of things that you are easily able to assist with in a patient care environment. Next steps. Back to Emma.
Back to me. Alrighty. So again, I get all the fun stuff. So next steps for you guys. The first one is stay connected. This is going to be so important. We talked about what to do if you have questions earlier. It's the same steps. And we talked about communication and how communication is key, and having open communication is what makes successful volunteering and successful relationships. So staying connected is going to be huge. Please continue to check for communications from the Volunteer Services Office. Check your emails, check your emails, check your emails. All of our important communications, updates, guidelines, policy changes, anything like that is going to be sent through the Volunteer Services Office. It's going to be sent to your email. So please be continuously checking those because that's where you're going to get that information from us. It's also where and how your SLB is going to communicate with you as well, is going to be via email. And you're going to be receiving those email updates. So like I said, any important information pretty much regarding volunteering is going to be sent to your email. If you do have any questions, again, send them to the Volunteer Services Office at that volunteerservices@uiowa.edu, and then reach back out if you haven't heard from our office in a couple of days. So in that 5+ days is kind of what we say, 4 to 5, right in there. If you haven't heard back and you feel like it's odd and you feel like you should have heard back, go ahead and send a follow-up email. Again, I said earlier, we do have staff that are answering every single one of your emails. So I know that it might feel odd, or you feel like it's waiting, or, oh, no one's actually reading this. I promise you somebody is. I promise you they're going to get back to you. Give it a couple of days. If you still haven't heard, then reach out again. Kind of the next piece of this too, as far as staying connected, is that all of your updates, and compliances, many of you are still going to have a few compliances that you're going to need to complete here in the next few days, few weeks. And all of those updates are going to be sent to you from the VSO. So go back, check your last email. You probably will have received a checklist. Each of you should have a checklist in your email from the VSO. It's going to be kind of like on a blue background, white background with blue in it. and go through and make sure that you've completed each of those steps listed in your checklist, because that's important for you to be able to start volunteering with us, start actively being on your units, and go to your actual set shifts that you're going to sign up for. So to be able to do that, we need to make sure that you are following each of those steps and have all of your compliances completed. So just be sure to be checking on that here shortly. So reliability, right? You guys have already signed off on our commitment, and said that you are willing to commit to our 2 semesters and 72 hours total for this commitment. Essentially, a reliable weekly record is dependent upon open communication with staff and reliable weekly service. We talked about this before, but that reliable weekly service part is super important as well. Those 3 hours per week are 48 hours, per a 16-week semester. For 36 hours in a semester, that equals that full attendance piece. So that's where we're getting those numbers from. But that's going to be key in it. For those of you that when you finish those 40 hours, not 40 hours, once you complete 40 or more hours, you are eligible to receive an hours confirmation from our office if you need it for an application or something like that, or classes. You're able to receive that when you complete your 40 hours or more. And then at your minimum 72-hour commitment total, you'll be able to request a personalized letter of recommendation from our office. We can't provide those to you, though, until you complete that minimum commitment. So when you complete that, then you can reach out to us and ask. Yes, so we're able to secure all of our varied and interesting placements. We have a bunch of wonderful units all over the place in a variety of different settings. And so we're able to do that based on the long-term commitment that you are able to make as volunteers and the fact that you are reliable and responsible. So we have had wonderful luck. We have had a wonderful time to be able to have fantastic volunteers, but it is because of this commitment piece. It's because of the dedication and the reliability and responsibility on your end that we're able to maintain those relationships with units and with staff to be able to keep those placements as options. The next piece kind of is that this is a really popular and competitive program. Our volunteer program is really competitive. We've talked about, in a typical year, 1,300 people, that's a lot. So right away as new volunteers, you might not get your very top choice of a unit placement as you're going through and you're signing up for shifts, or, as in your shifts and interview times, you might not get that top placement right off the bat. However, we do have, or reorientations available as you continue volunteering with our program. Maintain that reliable service record. If you keep your record in good standing and reliable service, you then would have priority coming back to maybe get the shift time that you are really looking for, or maybe, you'll be able to switch into another unit that you're really interested in. And so that will come with your reliability and your responsibility going forward throughout your time with us.
I think that's especially true right now, right? I mean, flexibility is key. And our placements, they're all awesome, right? I mean, we have a lot of great opportunities here. And sometimes I think it's easy to think, oh, you are wanting a particular experience. But honestly, sometimes when you end up in a different area, you see so many different things. It's a great way to learn about all kinds of different professions and care environments that you might not otherwise. And we do make it easy to switch. So we encourage you to try different areas every semester. Summer's a great time, right? We have great need in the summer and a lot more flexibility in shifts. So if you're able to pick up additional assignments, the commitment is shorter for summer session. And it's a great way to see a lot of different really awesome things that are going on here.
Absolutely. And the last bullet point that we have is that you guys have to record your hours in order for your record to be updated. So you are going to be able to learn a little bit more about this in your individualized unit trainings. They'll be able to show you where and how to be able to record your hours. Most of the time, this will be done through timesheets, potentially. And so again, they'll be able to show you how to work those, but you have to make sure that you are recording your hours every time that you're in for your shifts, because this is the only way. This is the only record that we have. This is the only way that the Volunteer Services Office and your record can be updated with your hours, is if you record them.
And all of our reports, right? Everything that goes to administration, I mean, everything is based on you recording your regular service reliably. It impacts funding. There's really not another way that we can show the impact that our volunteer team makes better than through ours. So take it serious. Even if you don't care that much about your own personal record, it's super important in the scope of things. So thanks for your attention.
Yeah, and as we're talking about recommendations as well, I mean, the only way that we're going to know how many hours you have or to be able to offer those recommendations when you complete the minimum hours required is if you're recording your hours and they're being updated. So it's really important to do so. If you are curious as to how many hours you have once you begin volunteering, you can check in with our office. You can shoot the volunteer services email, a communication, stop in, that kind of a thing, and we'll be able to provide you with how many hours you have recorded so far for volunteering. Alrighty. And finally, I would like to close with a quote from one of our nursing unit clerks from the burn trauma unit here at our hospital, Peaches Witch. She is wonderful, absolutely fantastic person, but I think she really cut to the chase when she said this quote about our volunteering program. So she says, "When I come through these doors every day, it's a reality check." Ooh, not what I wanted to do. Sorry, guys. It's a reality check. Regardless of what's happening, you have to be grateful for your life. I don't know if I could handle being on the other side of this. I want to make a difference for these patients and their families. So I really think that that's our goal here. That's what we're here to do. And that's what we want to strive for every day, that we're, in our hospital system and that you're volunteering with our program. So thank you so much for watching our video. We look forward to helping you make a difference here at the University of Iowa Hospitals and Clinics. Thank you so much. You're muted.
I am muted, but we're excited to have you on the team. Thank you, Emma. I will also add that I believe you're going to be asked to complete a survey. So this is the first time we've done this, and we really super need your feedback. So please take some time to complete that survey and give us your thoughts on how we could improve the information that was presented, maybe what you found especially helpful, any suggestions that you have. It's the only way we can get better is to hear your feedback. So you'll need to complete that survey to verify that you've covered this information, but we appreciate if you spend time with it and help us make it better for the next folks. Like Emma said, we're glad to have you on the team. Thanks so much.